base camp
Joe Hughes
20
never
years
thought he'd be here, inside of a clinic on
And
the
it's cool
base of Mount
because there was
Everest,
a crew from this
suffering
TV
from
program,
high-altitude pulmonary edema.
and you see what a
His
person looks like
fiancée
with
and
pulmonary
unborn
edema.
child waiting for him to come home.
The call stopped, and I was trying not to think the worst.
There's only one person who can save him, Dr. Luann Freer, and
This
from
is the
her
doctor with
makeshift
this camera.
Everest ER,
And you
she's
see this
about to
guy.
give a
He's
master
lying
class
down.
in medical immunization,
And he's breathing
all
very fast.
documented by a film crew.
What was his condition when he finally did arrive?
He was gravely ill. He was blue, he was
Yeah,
gasping
blue
to breathe. You could hear the bubbling in his chest without a stethoscope because blood is
And you
literally
hear the
leaking
breathing.
Cooling in his own lungs.
in your lungs, yeah.
And you can eventually drown.
Right. People drown in their own blood, and it's the most common cause of death at high altitude.
Now Dr. Freer is scrambling to figure out what to do, and the situation is becoming more dire by the moment.
Blue
He
lips.
was the closest to death I've ever seen of somebody with high altitude pulmonary edema.
You see how
What's the normal treatment for it?
High flow oxygen will help reverse the process. Unfortunately, in austere settings, you don't have unlimited oxygen.
What kind of medications did you give him?
We gave him everything I could think of that would decrease the blood pressure in the lungs.
Her skills pushed to limits even Dr. Sean Murphy would find daunting.
Were you just making it up as you were going?
A little bit. At that point, I felt like we got to throw everything at this guy. He's going to die.
The answer, a little blue pill that's come to many a man's assistance.
We used Viagra.
Viagra.
Yeah.
Have you ever
Viagra
heard
was
about
first
using
developed
Viagra
as a
for edema?
medication to decrease blood pressure in the lungs.
And it's okay.
Oh, really?
And then it's more
Can still be
lucrative.
used.
Side benefit became known.
In this situation, Joe needs a pill every 6 hours.
Did it work?
It did.
Somebody might ask, why did you have Viagra on Mount Everest?
We had it specifically for that because we knew we had limited supplies of oxygen.
But there was still the matter of Joe's severe dehydration. He urgently needs IV fluids. And in this
Edema. Yes, exactly. Exactly. It's a problem with the lungs. If it's very bad, I can't walk because I am exhausted. I have breathing very fast. Like I feel I lack oxygen. So like I'm breathing very fast, even though I'm sitting on a bed or I'm in my tent. Okay? This is pulmonary edema. And when it's very bad, you have also the lips that are becoming blue. You're pale. You don't recognize it when you see it for the first time. But basically, the people is gonna tell you that it can't breathe. It doesn't have enough oxygen. It's very bad for people with pulmonary edema, and we see them a lot in the hospital for cardiac problems. They see that they're really focused only on breathing. It's very hard for them to breathe and take oxygen in. And you remember what's the cause of pulmonary edema? What is pulmonary edema? What do you have in the lungs?
It's blood with a tumor
Exactly. I have blood coming inside the lungs.
inside the lungs.
So the lungs can't absorb oxygen because it's filled with blood. And which medication can doctors give to pulmonary edema in medical terms? Yes, Viagra. Very good. They have Viagra, and then there is another new medication, but it's not for you. That's very good. And if you have a person in pulmonary edema, what should be done? Most important thing, descend. Descend. Always. People in pulmonary edema, take them down. If I have oxygen, good, better, but just for waiting to organize the crew to take the person down. This is very important. Clear?
Yeah.
Yes.
Exactly.
Exactly.
Inside the brain, swelling inside.
Exactly. Cerebral edema is swelling of the brain. Lot of blood in the brain. Pulmonary edema, blood in the lungs. Cerebral edema, blood in the brain. it becomes big in a closed room, and you see people that is like drunk, that is talking to you strange, like a drunk people, or is not able to walk right.
Confused.
It's confused. Treatment for cerebral edema, most important, descend. Always descend as soon as we can. Take the person down. Exactly. For these two cases, if you take people down, you save their lives. Okay? Probably the hard one is cerebral edema, because people sometimes feel fine, they're not aware that they have a problem, and maybe they continue a hike or the climb, and because they paid, but you need to tell them, listen, you're not watching, I check for fire, I check for electricity cable, but during a rescue, you're not expecting that. You're walking with your phone on the street, and you see a person down, you're gonna go right away and check him out, how he's feeling, because it's what it comes natural to us. But it's in that moment that you need to remember, Giovanni told me about safety first, and then stop, take a few seconds to check if the scene is safety. I repeat you, every month, people die because they see a person on the side of the road. Oh, that person is bleeding, that person has been injured by a motorbike, there is a car accident, and they rush toward it, and they don't look at the road, and a truck comes by, and they die. Many people. And we understand it, because you want to help someone, you don't think of anything else. But the most important thing is your safety. So before helping someone else, you need to be sure that you're safe. During a climb, if you get close enough because you don't have the gear, you don't have the rope to belay yourself safely, you just check from as far as you can. Safety first, very good. Then I can safely get close to the person. I can start checking what's the problem. And first thing I check on the patient is if his or he, what do I check first?
Breathing.
Before?
Unconscious or conscious.
Exactly. Before I check if the patient is conscious, the patient is talking to me. Open the eyes. Hey, how are you? Yeah, I feel pain in my leg. It's okay, the patient is conscious. Okay? If the patient is conscious, is also breathing. Okay? So this is very easy. If I check the patient, hey, what happened? And it doesn't reply, then what should I check? If the patient, I talk to him, hey, what's happened? And it doesn't speak, what do I check?
Breathing.
Breathing, very good. And how do I check if a person is breathing or not? How do I do it? How do you check? Okay, very important this one. Don't check for pulse. Maybe you have cold hands. This is for doctors and nurses. Don't check for pulse. You check for breathing only by looking at the chest. Okay, only looking at the chest. You can put your hands on the chest. If the person has too many jackets, I need to check. I count for 10 seconds. 1, 2. I see the chest moving. Okay. The person is breathing. I take 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. These are 10 seconds. Take them all, don't rush. Because when you're having some, it's not replying. Okay, 1, 2, 3, 4, 5, 7. No, take your time. It's a very important information. You open up the jackets, high altitude jackets, whatever, to uncover the chest, the t-shirt, and check if there is a breathing. Okay? don't look for the pulse because sometimes it's very hard. Also for nurses and doctors, they have cold hands and vasoconstriction, it's very hard to check the pulse. Forget about the pulse. Just check for breathing. That is not breathing. Consider the worst situation. Okay? Conscious, unconscious. If unconscious, check. Is when your body temperature goes below 35, or usually 36, 37, 37.5 with fever, okay? When you put thermometer, or you get near thermometer, and temperature of the body is below 35, that's hypothermia. And why hypothermia is bad? What happens if you go into a hypothermia? Try it. Yes. You become sick because all your body is meant to work at 36, 37 degrees. If you decrease temperature, like a car, it doesn't work. All the cells can't work. The proteins in your body don't work when the temperature is too cold. And so, at lower temperature, your brain doesn't work okay, your lungs, your heart don't work okay. Put a person in hypothermia, as we said. What can cause hypothermia?
We have to keep it at one.
Very good. But why a person goes into hypothermia? Yes, the cold outside. Let's see what happened. So basically, if the temperature goes down a little bit in your body, the first thing that you don't realize is that you start shivering. Why? Why people cold do movements, shiver as formations? Why? What does moving make? Yes, but another thing, more important. Why? How many of you, when cold, started doing this? How many of you? Anyone that had shivers? Have you ever been cold and started doing like this? Any of you? Come on. Why? And you can't control it, you just trembling. Why? Exactly. These movements, very fast movements of your muscle, this contraction, they produce heat. They produce temperature. You can control it, but your body feels that the temperature is going down, and you need to fight against it. And so without thinking, you start shivering. If the temperature goes very low, the body has cardiac problems. And when you're below this, also your brain is not working well. Around 30 to 38 degrees, people start becoming unconscious. Unconscious. So, for example, you see that a person can become unconscious also for temperature. And if you see an unconscious person, what would you do? What do you do? You see an unconscious person. You don't know why he's unconscious. What do you do? Before doing CPR, you need to check something. Safety, very good. Before approaching, I check this safety. I call this person that has spent one night in the tent or in a bivouac. I call for him, but he's unconscious. He's only here, okay? We bring the person in a warm place, in a tent, preferably with someone else, or in a warm place, in a refuge, with a fire, whatever. We bring it to a warm place. If we put dry clothes, warm clothes, We make people moving. If the person is conscious, because he's conscious at this time, and there's no problem, no injury, come on, you're cold, you shouldn't come. Let's have a walk, even like jumping on the place. Moving produces heat. Moving increases the temperature. So moving, and give them to drink hot tea, hot beverages with sugar. Because the sugar is like fuel. If you give fuel to the body, it's going to burn this fuel and produce heat. Okay? It's very important. So, call the person, put it in a workplace with someone else, make him move, so to help produce heat, dry clothes on, and if you have warm beverages, a lot of warm beverages with sugar, possibly no alcohol, later, when the person is in bed. If it's lower, there is nothing that you can do. You already done this thing, so you try to keep the person warm, but below 32 degrees, the person needs to be hospitalized. Okay? You see that there are two sides of this one, gold and black. For those ones that didn't see, you can check it. Which side do you put against the person? The silver one or the gold one? Who's going to go for the gold one? Gold one?
Outside. And white side inside.
You want to put the white side inside? How many of you agree? I agree with him.
Yeah.
I have no
Silver
idea.
inside, how many? Silver
idea.
inside, silver inside, silver inside. Golden inside, golden inside, golden inside. Come
No
on,
idea.
don't be shy. Golden inside, silver inside.
Silver inside.
Okay. Kathmandu, because they spend the night outside. So we're not talking about something that you'll see at base camps or higher camps. It's something that can happen just if you sleep outside at the city level. So again, it's very important to prevent it and to also be aware of your customers, of your colleagues, to prevent, because there is nothing you can do on the long term. What are frostbites? You had one. What is frostbite in your words? Exactly. There is some parts of our body that gets frozen. Okay? So basically what's happening is that we have a lot of water, and these make happen that we have ice forming in our hands, in our feet, in our nose, in our ears, in our cheeks. Okay? So it can happen in every part exposed of our body. It usually happens below 5 degrees, and it's not a magic thing. -5, you can have it in Kathmandu at night sometimes, I guess. Or during most stress. Not -5 in Kathmandu? No. Not you're lucky. But if you go, I guess, a little bit higher up, you can have -5 in winter. 2,000, 3,000 meters, you can have -5. And so it happens. And these are the two things that can make a frostbite happen faster. If you have these make happen that we have ice forming in our hands, in our feet, in our nose, in our ears, in our cheeks. Okay? So it can happen in every part exposed of our body. It usually happens below 5 degrees, and it's not a magic thing. -5, you can have it in Kathmandu at night sometimes, I guess. Or during most stress, not -5 in Kathmandu. No. Not you're lucky. But if you go, I guess, Little bit higher up, you can have -5 in winter. 2,000, 3,000 meters, you can have -5. And see it happens. And these are the two things that can make a frostbite happen. These make happen that we have ice forming in our hands, in our feet, in our nose, in our ears, in our cheeks. Okay? So it can happen in every part exposed of our body. It usually happens below 5 degrees, and it's not much if you think. -5, you can have it in Kathmandu at night sometimes, I guess. Or during most stress. Not -5 in Kathmandu? No. Not you're lucky. But if you go, I guess, a little bit higher up, you can have -5 in winter. 2,000, 3,000 meters, you can have -5. And so it happens. And these are the two things that can make a frostbite happen faster. It's not random hot water, but you see here they're using a thermometer. So you want to have just a little bit more water than it should be, a little more temperature than it should be, so around 38. And you wait until from white it gets back to pink or black if it's bad damage, or to purple. Sometimes you can have also blood bubbles coming out of it. You've seen it? On who? Gloves, maybe the gloves were wet, so try to give him your spare gloves that are dry. This helps a lot. And of course, this will be the best treatment. Put the hands in warm water. Where I use the thermometer. The thermometer I use for the fever is good also for the water. Let's constantly check that it's not too high, because otherwise I risk burn. People with frostbite, they don't feel anymore. Okay? If they have the frostbites, they barely move the hands and they don't feel anything. So if you put the hands in very hot water, they don't feel it. And so you risk to cause hot burn. Okay? What not to do? If you reward the victim, don't go out again. It's not a piece of ice, the meat, so don't put it on a very hot surface. Okay? Again, they don't feel the pain, they don't feel the heat, so if you put them against a fire, then it's going to burn their skin. So the treatment, if you want to rewarm, is hot water. That's it, with the precise indication of temperature. No rubbing, no massaging, just put the dry stuff on it, dry clothes, and if you can, warm water. Okay? Now, the most important thing is to have them dry. Weakness, they have cool hands because, we want to be strong men, and then they lose their fingers. So this is also for you. If you have cold hands, ask for help. If you feel cold, tell the people around you that you feel cold. Maybe they'll lend you a jacket or hot tea, or you move. But there is no point in risking your lives or your hands or your feet just because of pride. Okay? So if you feel that it's too cold for you, the weather to go on, stop and go back if you can. Find a warm place, but try to make yourself as safe as possible, because there is no time that is worthy of fevers, for example. Okay? Do you agree?
Yeah.
You move everywhere, go here in the city behind the mountains, and now actually you can save some lives with the practical skills and bike, okay? And they're not doing anything crazy, they're not doing big jumps. And at some point you'll just see one of the two guys falling while they're running normally, and let's see about the wound. Nothing crazy, some heels. Nothing bad, just a small fall. Attention. Now, 5 minutes pass, 10 minutes pass, they call the rescue, press arrive. You see the keeping pressure,
Mm-hmm.
the punch on the leg,
Yeah.
Italian rescuers.
Sir, may I try?
Yeah, we'll try
Okay,
now.
try.
Everybody
I
try.
never use it this.
No, today we spend most of the afternoon trying.
Okay. कसरी को यो यसलाई यस्तो गर्ने होला है?
त्यो टाइट गर्ने हो
टाइट गर्ने? यस्तो गर्ने अनि फेरि माथि।
यहाँ हाम्रो काफ गरे
अनि ठिक छ यो जहाँ पनि मैले उ गर्नु खोजेको अनि यसलाई चाहिँ यसरी-
अलि माथि गर्नु न सजिलो हुन्छ
ओके
त्यो घुमाएर टाइट गर्ने
Or let's say you have bleeding here, big bleeding. Okay. First thing you want to do is pull as much as you can with this one. Okay. Then you see now I feel your pulse. I turn until I don't feel your pulse anymore, or I see that bleeding stop.
Oh, okay.
Okay. It's painful. It's painful. I go light
यस
because otherwise I ruin the jacket. And when it's very painful and I stop the bleeding, I see that the bleeding is stopped and I can feel the pulse anymore. Locks.